Healthcare for Talk 365 is provided by BodyRenu.
And welcome back to Talk 365. Trip Mitchell, Holly Love. We're going to talk about your most important muscle.
Yes, I think you're right this time saying the muscle. This is the first time. We're always talking about the brain and you try to make it a muscle. Anyway, announce it, go.
No, but in all seriousness, heart disease is the number one killer. It is the most important, and it catches you off guards. And I was talking to Andy before the show, and I worked with a heart surgeon in Kona, and we did a show called Doc in the Box for the American Heart Association about really what you can do to prevent heart disease, and it has been a focus. And that's the one. If the medical community can knock down heart disease, then that will extend the quality of life. And
it's the number one. And it's the number one thing for Dr. Brian Rodgers from BodyRenu. It is something he personally wants to take down, not bring back. Like I said a minute ago, he wants to take it down from being the number one killer, and he knows how. So check it out.
Talk 365's Talking Wellness segment is brought to you by BodyRenu with wellness team expert Dr. Brian Rodgers.
Hey everybody, welcome to Talk 365's Talking Wellness. Today I have got Dr. Rodgers, our wellness team expert, here in studio as promised. How are you?
I'm doing great. How are you doing today?
I'm doing good. Thanks for coming to our house.
Well, thank you.
Yeah.
It's nice to be here.
This is super fun. So I am really excited for this interview because we've been waiting for this one because it's a big one for you. This is your baby.
It is.
It is your heart center.
Mm-hmm.
We're talking cardiovascular disease, and it is something that Dr. Rodgers specializes in. Let's talk about why you find it so important.
Well, I have a number of patients in my family practice office, and I treat cardiovascular disease all the time, high blood pressure, prevention of stroke, and heart attacks. And I've had some patients who've listened to me, and they've done pretty well. I've had other patients that didn't follow what I said, and they ended up having a heart attack or stroke, and their lives have changed dramatically for the worse. And they're having to use walkers, they don't have the energy they used to have, and it's sad to see that when it could have been prevented. Heart disease has been the number one killer since 1910. That's over 100 years, except for a couple years where the flu was the number one killer. And other diseases have been treated better by our healthcare system, but heart disease, over 100 years, has been the number one killer. You'd think that we'd do something about that.
Yeah, so is it just that the specialists are not doing their job, or what's the deal?
No, we've got excellent specialists. The cardiologists and the cardiovascular surgeons in the United States are top of the line, couldn't do it much better. They're doing great with what they're having to work with. Cardiovascular disease starts 20, 30, 40 years before someone has an event.
Wow.
And it's important to know about these things. If you catch that you're starting to have cardiovascular disease 30, 40 years in advance, you can make some minor deviations in your life to treat it. If you wait until a month before the heart attack or after the heart attack, it's much more difficult to treat.
Usually the heart attack doesn't schedule it with you though and tell you, hey, I'm a month out. It's a surprise attack for the most part.
It does surprise you.
So how do you know if you're at risk for a heart attack or cardiovascular disease? Is there a way to pre-screen or?
Well, there's lots of ways. Right now, typically what they say is if you have one of 5 risk factors, if you're a smoker, if you're overweight, if you have diabetes, if you're a male, if you exercise, and some of those other things, and they look at that and they look at your cholesterol levels. And if your cholesterol levels are fine, then no problem. You don't have a risk of heart attacks. But the problem with that thinking is that there's a university study done on people who go to the emergency room. Did you know that 50% of the people who go to the emergency room for heart attack or stroke have a normal cholesterol panel?
Wow.
And so cholesterol is not the best indicator. Stanford University recently did a study, and they combined some of these traditional cardiovascular risks with other unique proteins that are in our bloodstream. And with the combination of these two things, they can tell someone what their 5-year risk of having a heart attack is.
Wow.
In fact, that's done through Cleveland Heart Lab, and with insurance, it's a $30 test. It's simple.
Your blood panels that you do will let people know if they're at risk, and once they know, what do you do?
Okay, the blood panel that you had is not the panel that says if they're at risk or not. It does indicate risk, but if you want a quick lab test, I've got one that I can do that says you're at risk, this is your 5-year risk. The panel you're talking about is someone who is at risk, I would do.
Yeah.
A major contributor to heart attack risk is inflammation. Well, we look at special inflammatory markers in the artery to see how close to a heart attack you are and how to specifically treat you. Each of us have unique genetic factors that may or may not put us at risk. It may make it worse for us or decrease our risk. I check for some of those genetic factors to see what someone's individual problems are. We check nutrition, we check hormones, vitamin D levels. All these things have an impact on an individual's heart attack risk. There are over 400 known factors that are risks for heart attack. We typically check for 5. And all these other 400, pick any 5 of those other 400, and they can cause as much risk as the 5 that we look for. And maybe, in Utah, a lot of people don't smoke or drink, and a lot of them exercise, so they appear to be good. I've seen people that have appeared to be very healthy, but have had other genetic factors or nutritional factors, and they've had heart attack or stroke at an early age.
Yeah. So once you know these genetic or unique factors, what can you do to prevent? How does that kick in?
Well, in order to prevent, you want to treat their unique individual disease process. Traditional medicine says we get your blood pressure down, we stop you from smoking, we control your diabetes, and we throw you on a statin drug to control your cholesterol. It's pretty much cookbook medicine. Everybody gets the same treatment plan. Well, with me, I look at what's wrong with each individual. Is there a genetic issue that we need to do a workaround to help you be healthy? Is there a nutrient that's low? Is there exercise and diet changes that need to be made? Are there other supplements that can be used? We can also use those blood pressure and statin drugs if needed, but we try a whole bunch of other things first, and we individualize our care.
Which is what I love so much about your practice and going to BodyRenu, is that you know that you are being treated holistically. You are being looked at from all angles of ways to treat from the ground up, for the most part, with functional medicine. That's what it's all about, right? And not always just a drug, which is my favorite thing. I'll never forget when I walked into your office and there was a big sign up during cold and flu season to take a supplement to prevent the cold and flu, which I love that. I love that you're a DO that is willing to look at all of it, how medicine plays in, where you can use herbs in diet, and where you can do natural things like how you're living your life, how you're sleeping. I know that's the one thing we always talk about, is how much I'm sleeping all the time.
Absolutely.
Yes, which is, I'm doing better.
Incidentally, if you want to reduce your cardiovascular risk, you'll go to bed at 10 o'clock each night, sleep for 8 hours, and that will reduce your cardiovascular risk.
Okay, I will put that on the to-do list next to the whiteboard we're gonna get, right?
Absolutely.
So let's talk a little bit about, if they mention Talk 365, how do they get their blood work done?
Well, if they come into our office, we'll have them do that $30 panel to see if they're at risk for cardiovascular disease. That is $30 with their insurance. And then we will offer a free consultation to explain the results of that panel and where to go from there. If you contact our office at BodyRenu.com or call us at 801-677-0039.
Perfect, I love it. I would recommend getting in there and get the big one too at the end of the day. That one was a really cool experience because you have this opportunity to sit down and he looks at your life from like the day you were born until now. And we talk about things like, oh no, your problems didn't start a couple years ago, they started when you were 3. And what happened at 12? He can figure this out from the blood work that he does, and it's amazing to know that your doctor knows this much about you. It's the coolest thing, and it's why I love you so much.
I wish I could do it all with blood work, but that's with blood work,
There's
health history, and other things. But I'd be happy to do all of that.
Well, I recommend you go in and ask for the Holly full package. You just should, because it's amazing and you're amazing. And
Well, thank you.
Talk 365, we love you so much. Thank you for coming over to the studio and spending some time with us today to talk about cardiovascular disease. It's a big thing. We need to get in there. We need to know about it. And if you're worried that you're at risk, give BodyRenu a call. Thank you so much.
Thanks for having me.
Don't go anywhere. We'll be right back on Talk 365 right after this.